medicine is one tool in the toolbox, but if you're not ready for it, you're not ready for it, right? Because parents will often think, like, gosh, am I making the right choice? I don't want them to be a zombie. I heard lots of bad things about medicine. I don't want them to become dependent on it. There's all these things. And I don't want a child or somebody on medicine unless everybody's on board. Because if you yourself have any reservation and you're asking your child to take a medication, they're going to feel that. They're not going to like it either. So we have to take our time to kind of figure out where you are feeling about medicine, what your partner's feeling about medicine, and what the child's feeling about medicine. We have to start there, right? So everybody has to be on the same page and understand that how medicine would work and what it's supposed to do. Okay. And what to look for. So that's one. We talk about whether or not medicine is something that they're willing to embark on. But behavioral therapy is another thing, right? What are the skills? Because even if we were to start medicine, pills don't teach skills. So, I mean, medication can help decrease the severity, intensity of these core symptoms of ADHD that we've already talked about, but it's not going to automatically teach kids how to organize, prioritize, use their time well, manage their emotions. It's not going to do any of that. We still have to teach those skills. And that's where parents are really important, in that. They can teach, kids look to parents as their first teachers, your opinion counts. So they're always going to look to you for what to do, right? But sometimes parents may have ADHD themselves. They were raised a certain way. They might not know how to handle it. So working with a therapist or a coach is helpful. So we need to identify, where are those lagging skills? Is it socially? Is it with emotions? Is it with academics? And then find someone who you connect with, who your child connects with, to teach those skills. Third, parenting support. So for you, right? Because kids, their brains are still developing until age 25. We often need to lend our executive function to our children. We need to learn how to stay calm in the moment and model appropriate skills. And, it can be quite frustrating at times. And so parents need support too. And then school accommodations, a 504 or an IEP. These are school plans that can help make sure that children thrive in the school setting and meet their needs, whether that be preferential seating, away from busy areas, getting breaks, using a visual timer, chunking assignments, those kinds of things, versus pullouts or push-in services to help with remediation of different skills. So all of these are important, in addition to then also teaching kids about self-care, like I had mentioned before, eating, sleeping, moving their body, and screen time moderation. All of those things need to be moving the needle so that the person with ADHD is thriving.